The moment your IBD team suggests biologics, the temperature in the room usually drops. You hear names like infliximab, adalimumab, or ustekinumab, and then you go home, read the leaflet, and see a terrifying list of side effects. You might be thinking, is my Crohn's or colitis really that bad? Or am I going to be on these strong drugs for the rest of my life? If you're hesitating to fill that prescription because you are scared, I need you to watch this video before you make your decision. Hello everyone, I'm Dr. Dhingra. I'm one of the consultant gastroenterologists working in the NHS UK. And today I'm going to discuss with you about what the biologics are and help you understand why we are using it. I'm going to break down useful info on biologic medications. I'll explain exactly how they work, the difference between the drips, the pans, and the tablets, what we do if they stop working. Let's get into it. First, let's demystify the word biologic. Patients often think these are nuclear weapons that wipe out your whole immune system. Actually, they are more like snipers. Drugs like steroids suppress your whole body. They are messy. Biologics are targeted medicines. They are smarter. They block specific proteins or pathway in your immune system that cause inflammation. For example, anti-TNF. Drugs like infliximab, they are anti-TNF. They block a protein called TNF-alpha. Gut-selective drugs like vedolizumab stop white blood cells from entering the gut in the first place. And there are newer tablets like the JAK inhibitors. They block the signals that tell your body to attack itself. So we aren't just drugging you, we are blocking the specific pathway causing your pain. Now the practical question I get most is, Doctor, will I have to spend my life in hospital? Not necessarily. Depending on the drug, there are three main ways we give them. Option 1 is the infusion or the drip. You come into the hospital, say every 8 weeks or so, you sit in a chair for a while, and the medicine goes into your vein. That's the infusion. Option 2 is the injection or the pan. Drugs like adalimumab usually come in a pre-filled pan. You don't even see the needle. You just press it against your body, say your leg, click, and 10 seconds later, you are done. Most of my patients do this at home. And option 3 is the targeted tablets. New drugs like filgotinib or upadacitinib are tablets you simply swallow with water. So if you have needle phobia, tell your consultant, we have got options. Now let's tackle the fear. Does this lower your immune system? Yes, because you're blocking inflammation, so your body might not fight off infections quite as well as usual. But here is the consultant perspective you need to hear. The risk of leaving your Crohn's or colitis untreated is usually far higher than the risk of the drug. Uncontrolled disease can lead to surgeries, strictures, and hospital admissions. The drug protects you from that. Obviously, before we start you on any medication, we screen you for things like tuberculosis, certain viruses to ensure that you are safe. And we monitor your bloods closely as well. Finally, I want to talk to you about why drugs sometimes stop working. For some people, treatment works very well at first, but over time, the symptoms can come back. And why is it so? It's because your immune system recognizes the drug as a foreign substance. So over time, it thinks that it is harmful and it produces proteins called antibodies against that particular biologic medications, and these stop it from working as well. But here's the good news. If this happens, it's not the end of the road. There are options we can take. We can increase your dose, we can shorten the time between the doses, or we can add another drug to help lower your antibody levels. Or obviously, we can switch you to a different medication. So if your symptoms come back, don't panic, we have a plan. So if you're sitting on that prescription, my advice is this: don't see Biologic as a failure. See them as a tool that gets you into deep remission. These drugs are the reason many of my patients are living normal lives, working, traveling, and eating what they want. If you have any questions about a specific drug, drop them in the comments below. Thanks for watching this video, and I'll see you in my next video. Thank you.